Good afternoon and welcome. At this time, I would like to ask you to please silence your cell phones. If you need to step out for any reason, you may do so from the rear doors. We also ask that you remain in your seats for the duration of the program. We do have a staff photographer who will be capturing the students, and these photos will be made available to them. Please do not approach the stage. Now, ladies and gentlemen, please stand as you are able. Our ceremony will begin.
Let me just adjust the mic. Good afternoon. Please be seated. My name is Dr. Ruth Marr. I am Chair of the Department of Physical Therapy at PCOM Georgia. On behalf of the faculty, staff, administration, and students, especially the DPT class of 2026 of Philadelphia College of Osteopathic Medicine, I welcome you to this white coat ceremony. Now please stand as you are able for the invocation to be offered by Dr. Linda Atkinson, PCOM Vice Provost, and then the Pledge of Allegiance led by Savannah Adams, the class of 2026 PT Council Vice President of Relations.
Let us pray. Our Father, we are thankful for many blessings as we gather today to celebrate the beginnings of a noble journey. These students who stand before us are embarking on a path of healing. We offer our support, our wisdom, and our hope. Be present with them as we present themselves for training. Help these students approach their studies with dedication and curiosity, finding strength in times of challenge and humility in moments of success. Let compassion be their guide as they learn to care for others, and may they always remember the profound impact that they will have on countless lives. Grant these students the courage to face the unknown, the perseverance to overcome obstacles, and the wisdom to recognize and honor honor the responsibility of their chosen profession. Bless these students as they mature into healthcare professionals while remaining anchored in the humility of their family traditions. As they don these white coats, symbols of their commitment, may they be filled with a sense of purpose and a dedication to service. Let them carry with them the trust of their patients, the support of their peers, and the knowledge of those who came before them. In the years to come, may they find fulfillment in their work, joy in their relationships, and peace in their hearts. We ask for blessings upon their journey as they step forward to heal and comfort and to serve. Be with the families here today and those unable to be present, students and their families, and the faculty, and move us all in the ways of loving kindness, peace, and justice. Amen. Please remain standing.
Flag's over there. All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with indivisible, with liberty and justice for all. You may be seated.
Thank you, Dr. Atkinson and Ms. Adams, not Dr. yet, for leading us in the invocation and the Pledge of Allegiance. Today marks a very special time in the life of these students receiving their white coats. While many healthcare professional programs conduct a ceremony like this shortly after matriculation to the professional education program, we have decided to schedule it after completing the first didactic year and the first clinical experience. This allows us to not only welcome the students to the profession of physical therapy and make the transformation that is occurring in their lives, but also to celebrate their accomplishments during the program. The students we celebrate today have shown perseverance, patience, and commitment as they have endured the challenges of the Professional Doctor of Physical Therapy curriculum. Today, you will receive your white coats. Your white coat symbolizes your transformative journey in becoming a healthcare professional. As student physical therapists, your white coat is not merely a sign that you are a healthcare professional. Your white coat is an everlasting symbol of the physical therapy profession purity of purpose, placing the interests of patients and clients first, above self-interest. It's also a symbol of your integrity, trust, and compassion in addressing the rights and needs of your patients and clients. I want to draw your attention to the two patches on the sleeves of your white coats we are presenting you with today. Both patches remind us of the tradition in which these students are being educated, the osteopathic tradition, which emphasizes a whole person approach to patient management. It also shows a commitment to the advancement of knowledge and intellectual growth and engagement in the well-being of the community. PCOM has a long history of educating healthcare professionals, as you can see by the date on the PCOM patch. It's 1899. These are two words in the center of the patch, mens et manus. These words remind us that as professionals, we should use our minds and our hands, very appropriate for physical therapy. The second patch represents the program specifically, and keeping with college policies and guidelines, is built around the boldly colored flame. The flame reminds us that the desire to grow professionally, seek the well-being of individuals and the community, and see patients or clients as whole beings. And it's an internal flame that should never be extinguished. Once again, welcome. Now, unfortunately, we were to have a guest speaker, Dr. Jocelyn Gerard. She was in our first class that we graduated in 2021, but she's had a medical emergency. And she's asked for our office manager, Miss Melissa Tavilla, to speak on her behalf. But before that, I'm going to welcome Tucker Champeau from the class. He's the PT president. I'm going to ask him to approach the podium and read a short bio about our guest speaker.
Thank you, Dr. Moore. Just a little bit. Good afternoon. My name is Tucker Champeau, and I am the class of 2026 PT Council President. And I'm pleased to introduce Dr. Jocelyn Garrard, even though she won't be here. I'll be reading her bio today. Jocelyn is a 2021 inaugural class graduate of PCOM. She graduated from Kennesaw State University with a bachelor's degree in exercise and health science in 2011. Between 2011 and 2018, Jocelyn was a strength and conditioning coach for elite-level softball players while competing in CrossFit. It was during this time that Jocelyn learned more about the field of physical therapy and the profession's ability to provide athletes with not only tools to recover from injuries, but enable them to perform optimally. These experiences inspired her to return to school to pursue a doctoral degree in physical therapy. After great experiences in her clinical rotations with Dr. Bell at Piedmont Henry Hospital, ICU, and Dr. Fleury at a Level 1 Trauma Center, Navicent Health in Macon, she began working at Doctors Hospital in Augusta, Georgia, specifically in their burn unit, including the outpatient wound clinic, outpatient burn management, and inpatient burn ICU. After the birth of her second child and soaring daycare prices, Jocelyn took a step back from full-time patient care and began working alongside her husband. They opened an outpatient chiropractic and physical therapy clinic called Pure Motion. Jocelyn has a 3-year-old son named Ollie and an 17-month-old daughter, Emily. She now spends her time running Pure Motion, raising her kids, and competing in Olympic weightlifting, and traveling with her family.
First, I want to say congratulations for making it to this point. The first year of PT school is brutal. Adjusting to an insane workload, outside stresses, and high expectations from peers and professors. It is not for the faint of heart, so congrats. When Dr. Meyer invited me to speak at your white coat ceremony, I said, sure, but what can I talk about? Her answer was, you have a great story. Just tell that. I thought about just telling my story post-graduation, what you have to look forward to, but that wouldn't do justice to my story or the theme of the speech. During my story, I want you to remember the underlying 2-step process in the back of your mind. Step 1, develop a plan. Step 2, go for it. Beginning PT school with the difficulty of summer courses hit me just like the rest of you. It was hard, and it hit me like a brick wall. Alongside classmates and hours of studying around the clock, we survived one origin and insertion at a time. PT info. The real fun started in November 2018. Around Thanksgiving, I was diagnosed with mucoepidermoid carcinoma, a rare salivary gland cancer. I sat down with Dr. Palmer, the department chair then, and Dr. Miller to tell them and discuss what the school would be like while I undergo surgeries and clear the cancer. They were more than understanding and sympathetic, mainly wanting to support me as best as they could. My first scheduled surgery was for December, final exams. And although I'd been reassured I would be fine, I was very stressed, missing exams, not passing, etc. So I knew I needed a plan, which was the beginning of my 2-step process. Develop a plan and go for it. I arranged an exam schedule before and after surgery with each professor. Every Sunday I would look at my week and develop an hour-by-hour block schedule on when I could study and work on assignments. I had the schedule on a sticky note by my computer and deleted items as they were completed. I prioritized things by due date and weight of importance relative to the course. I even incorporated when I would work out, eat, and take breaks. I lived this schedule. It was the consistency to the chaos. I knew I could get everything done, and though the surgeries with the schedule, through the schedule, I had to have 2 subsequent surgeries, one in January and one in May. I utilized the same plan I had developed each time to make it through without getting behind in my schedule. This plan also helped me cope with my anxiety as I navigated life as a perfectly healthy young person diagnosed with cancer. This diagnosis changed me. It made me realize there would never be a perfect time for anything. Life doesn't care what you're going through. Time continues to tick. Circumstances change, and it's up to you to go after the things that matter. If you want something, develop a plan and go for it. My husband is a Canadian citizen in chiropractic school at Life University on a student visa. On this visa, he had 1 year after graduation to work in the U.S. before he had to give it up. We knew we wanted to get married eventually and stay in the U.S., so we developed a plan for him to be able to stay in the U.S. and went for it. Height of COVID, April 2020, we got married at the courthouse and started the spouse visa process. I was due to graduate in May 2021. I'd be 33 years old. We wanted to have kids. I didn't want to be too old when having children. Continuing through PT school was the only thing that made things hard. Again, circumstances are never perfect. We wanted a family, and I didn't want a geriatric pregnancy. Is that funny? 33? Now I don't fully recommend this, but I think I'm a little crazy, so I developed a plan and went for it. We thought I could give birth in June after graduation, before boards, if I got pregnant during a specific month. Again, I said I was a little crazy. I didn't disclose it to my professors and Dr. Wiley, who was in charge of clinical placements at the time, that this was a planned pregnancy. But it was all part of my plan. She helped me plan my clinical sites, so my last and longest one would be at an outpatient clinic when I was most pregnant. During clinicals, I began studying for boards as if my life depended on it. I developed a plan that included taking practice tests and studying 5 questions in depth every day. I did this daily until graduation. Graduation came and went, and I needed a new plan for the boards. I needed a job, childcare, so I could begin my career. I learned that I loved acute care, specifically trauma, so I narrowed it down and went to search in Augusta, Georgia, where my family resides. I began to apply for jobs at 37 weeks of pregnancy. After graduation and before giving birth or taking boards, I had a phone interview at Doctors Hospital Burn Center. After the phone interview, I emailed the director and thanked her for her time. She invited me for an in-person interview. I'm 38 weeks pregnant now and have not taken the boards yet. There was no way they were going to hire me. Nonetheless, I replied to her email, accepting the invitation to an in-person interview with her and the burn therapy team. At that time, I disclosed to her that I was 38 weeks pregnant, so it wasn't a big surprise when she saw me. I was provided a job offer contingent on passing the boards, which I accepted. Ollie didn't come as planned. Nearly 2 weeks after the due date, born 3 weeks before the boards. My study plan, which had been working before birth, was now out the window. I needed a new plan. I purchased a study program that included video lectures, commonly tested items. I watched these videos around the clock while nursing, cleaning, going for walks. The day of the boards arrived, and I knew I had failed. It was hard. I walked out of the testing center defeated. My plan and all my studying had failed me. A long week or 2 went by, and I passed. Thank goodness, because I was about to develop a new study short-term life plan. 1 week of a deep breath, and then we moved to Augusta with our 4-week-old to help our families. So that's my story. That's how I got to post-graduation. Lots of crazy life changes. We both worked full-time, Ollie in daycare, and had to get creative. I had a great team of therapists and a supportive director. 1 year into my job, I got pregnant again. Our salaries were fine with 1 child, but in daycare. But did you know that 2 kids in daycare is at least $2,000 per month? If you want to have your child enrolled in a decent daycare, At this point, I would be sending at least half of my pay to childcare and rarely to get seen. We needed a new plan. After discussing many options, we slowly began owning our own clinic. I would rent a room in a facility for Max to begin seeing people outside of his full-time job. Our plan began to unfold slowly. It was working. Once his schedule began to fill up, he quit his job. During maternity leave, I saw a very similar caseload. And then after 6 months of a very limited PRN, I bit the bullet and dove all in, and now we work fully for our own practice, Pure Motion. We are still young and learning, but we're able to support ourselves and 2 other part-time employees. We have developed a 5-year plan and are working to see it through. This is my PT Life family history for the past 6 months. Every aspect required a solid plan, commitment to the plan, and going all in for it. None of this has been easy. Many big life changes have occurred in the past 6 years, most of them because we planned for them to happen, but we planned our life how we wanted it. We did not let circumstances or other life events dictate how we wanted to live. If you want something that seems hard, overwhelming, or out of reach, I challenge you to develop a detailed plan and commit to it. Without the commitment, your plan will likely crumble. Things will remain stagnant and hard. Progress towards your goals will not be made. When you leave here today, look at your goals for post-graduation. Look at your career goals. Look at your travel goals. Make a plan for all of them. Look at your goals for the next 6 months to a year. What do you want? How you will get from the chair you are sitting in today to there. Develop a plan, go for it, and stick to it. Thank you.
Thank you. That was a wonderful speech. Lots of great advice, and she was a wonderful student. I'm sure you're going to take all her comments to heart. So this concludes, oh, hold on a minute. Wrong page, not conclusion. We're going to start with the ceremony. So Dr. Pierce, if you wouldn't mind going to the pinning table. Dr. Lowe, would you come up here? Dr. Lowe is going to help you with the coating. And you have your little cards? Okay. So at this time, each student will come up to the stage to be coated by Dr. Lowe. And after receiving your white coat, exit the stage this way to Dr. Pierce, and she will give you your pin. Let's begin.
Chandler Allred. Gabriella Ba. Chandler Allred. Gabriella Ba. Dayton Barth. Monica Babawi. Colby Cantrell. Alexis Favors. Hannah Grace Floyd. Cameron Forrest. Caroline Gibson. Tyler Green. McKay Harding. Sierra Horton. Gwen Heiser. William Jacobs. Jessica Patrice James. Caroline Lee. Lacey Leslie. Jada Liggins. Cassidy Markle. Perlene Shella Matherin. Tucker Charles Matthews. Alexandria Moore. Rishi Nathan. Skylar Ramjeet. Cole Rogers. Savannah Lee Adams. Tucker Champeau.
Oh, yeah. Yeah, they're going to sit down. Congratulations, students. In closing, I commend you all for your resilience and perseverance over the past year and congratulate you, the class of 2026, on reaching this important milestone. The Physical Therapy Department looks forward to your continued transformation as a student and future physical therapist. This concludes our formal ceremony. Thank you for sharing this important event with us. Please remain seated until the faculty and students have completed the recessional. At that time, we will have the students gather outside for a group photo. We ask that the families stand back and allow the photographer to make the class photo without disruption. Thank you.